Hi there, it's Dr. Mashhood with a video on stroke. In this video, we're going to talk about why stroke is important, how we identify stroke, what are the common signs of stroke that might elicit us to think about somebody might be having a stroke, and when the patient reaches the department, for example, emergency department of any hospital, what initial management should be done, and what are the key performance indicators or the key KPIs which are internationally recognized in the treatment of stroke, and what are the treatment options which are available. It is quite a broad topic. What we're going to do is we're going to highlight and mention the most important or pertinent things regarding stroke. First and foremost, why is stroke important? For obvious reasons, the incidence of stroke is increasing in the general population around the world. That could be because of the dietary habits, lack of exercise, the busy lifestyle we are having. It's a multitude of reasons which are causing the incidence of strokes to be high. It's very important to suspect stroke based on the science, because if we do suspect stroke early and get the patient to the right centers and provide them with the right treatment, that can actually have a very good outcome for that patient. And even if they don't have a very good outcome, they will have a good amount of quality of life afterwards. So what are the signs that might suspect somebody having a stroke? There are a few actually. We're going to point out, highlight the most important ones. The first and foremost is sudden onset of weakness or numbness in one side of the body, which might include face, arms, or the legs. If it happens suddenly, it's most likely a stroke. Then the alarm bells should be ringing, and we should take the patient to the nearest hospital. The second most important one is inability to talk or understand things, or sudden onset of confusion in a normally healthy patient. The other ones are dizziness, lightheadedness, can be a symptom of a stroke. Sudden onset of loss of balance or inability to walk might be a symptom of a stroke. Sudden onset of vision loss on either one side of the eye is one of the most important signs of a stroke. Severe headache, which comes on suddenly, can also be a stroke symptom. Now, these are symptoms which we need to look out for. If somebody is having those, then we need to raise the alarm bells, take them to the nearest hospital. Now, as a pre-hospital physicians or the EMS services, they follow certain scoring system. The most commonly followed scoring system around the world is called Cincinnati Pre-Hospital Stroke Scoring System. The reason it's most commonly used is A, it's very well validated. Secondly, it's a very simple scoring. It consists of only 3 scoring. First one is when we ask the patient to smile, we might notice there might be facial droop on either side of the face. The second one is when we ask the patient to lift up the arms might drop down on one side, or there might be a slow drift. The third one is when we ask the patient to speak, they're having difficulty speaking, or they're having slurred speech. If any of these 3 symptoms are present, that highlights the importance that patient might be having a stroke. If one of these 3 is present, the probability of that patient having a stroke is 72%. If all 3 of them are present, the probability of having a stroke is 85%. Now, once the patient reaches the hospital, there are certain key performance indicators which are international guidelines, which must be followed. The reason they must be followed is it has been shown that if these KPIs or indicators are followed, it has a very good outcome for the stroke patients and reduces disability. The first and foremost is when the patient arrives to the emergency department, they should have a general assessment within 10 minutes of arrival. They should have a full neurological assessment within 25 minutes. They should have a plain CT head within 25 minutes. The CT head should be reported within 45 minutes, and the decision and treatment should be given, if needed, within 60 minutes of arrival. These are the 5-6 very important key performance indicators which any hospital or center which receives stroke patients should be performing or should be striving to achieve. The first and foremost is the general assessment. When the patient arrives to the emergency department, the first and foremost thing we need to do is do a quick ABCD assessment, making sure patient's airway is patent. If he needs oxygen, we should provide oxygen, making sure his conscious levels is high enough, make sure his breathing is okay, his oxygen saturation, respiratory rates is normal, looking at the circulation, most importantly looking at the blood pressure, because invariably in stroke patients the blood pressure is very high, and sometimes we have to start treatment for those high blood pressures. In the disability, the most important point is looking at the conscious level of the patient and doing a GCS, Glasgow Coma scoring, and also looking and checking for the bedside glucose, because patients who have low glucose or they're hypoglycemic, they can mimic signs of a stroke, and the hypoglycemia needs to be corrected before we suspect stroke in such patients. Along with the disability, we need to look at the pupils and in exposure, making sure there's nothing else which needs to be looked at. Once a plain CT head is done, we need to differentiate between different types of stroke. Coming on to different types of stroke, they are broadly divided into two types: the hemorrhagic, or the strokes in which there's bleeding inside the brain, and the non-hemorrhagic strokes in which there's no bleeding but ischemia, or lack of blood supply to certain regions of the brain, which then causes symptoms of strokes. The most common among these two are the non-hemorrhagic or ischemic strokes, which occupies approximately 87% of the total stroke patients. The 13% of the rest of the patients are the hemorrhagic strokes in which bleeding happens. The most important, obviously, is the non-hemorrhagic or the ischemic stroke, because that occupies 87% of the total population, and it's a certain type of stroke in which a treatment can be given, provided the patient fits into the guidelines and there's no contraindication for that treatment. So what is the treatment? The most commonly used treatment these days, and there's good evidence about it, is the fibrinolytic or thrombolytic treatment, also called as RTPAs. Now the importance of this treatment is, if it's given early, within 1 hour, it has a very good outcome. It reduces the symptoms of stroke and reduces the disability and has a very profoundly good outcome. But there are certain important contraindications. It cannot be given, this treatment cannot be given for patients who are less than 18 years old. Ideally should be given within 3 hours, but in certain patients it can be given up to 4.5 hours. In patients who are having active bleeding, internal bleeding, these medications cannot be given. If patient had a severe head injury or intracranial bleed within 3 months, this treatment cannot be given. If they're having hypoglycemia or blood glucose of less than 50 milligrams per deciliter, we need to correct the hypoglycemia, and at that point the medication cannot be given if they're hypoglycemic. If the blood pressure is above 185 millimeters of mercury systolic blood pressure, or diastolic blood pressure is above 110 millimeters of mercury, this treatment cannot be given. If patients are on any anticoagulant therapy, irrespective of the INR, this treatment cannot be given. This treatment cannot be given in patients who have platelet counts of less than 100,000. And in previous malignancies, the treatment is relatively contraindicated. So you can see there's a lot of contraindications, so we need to be very careful if we do decide a patient needs a thrombolytic or fibrinolytic treatment. So what is the criteria? First of all, the patient should have a clear CT head, the first one, because the ischemic strokes or the non-hemorrhagic strokes invariably do not show up on the CT if it's done within 25 minutes, because they take several hours to show up on the CT scan. And if the patient is clinically having signs of stroke with a normal CT head, which is done within half an hour, 25 minutes, hence they can qualify for this treatment. But certain patients can be given this treatment treatment up to 4.5 hours, 4.5 hours. Those patients must be less than 80 years old. They should not have severe diabetic or ischemic stroke disease previously, and they should not be on any oral contraceptives. Along with this treatment, there is another treatment which is quite new, which is being practiced in very few centers around the world, not all the centers. It's the endovascular treatment, in which physically we go in and take out the clot which is obstructing the blood flow. That treatment can be done within 6 hours. And again, it has certain criteria, inclusion and exclusion criteria, which needs to be fulfilled before the treatment can be given. So just to summarize the importance of stroke, we talked about the important signs which will which make us suspect that the patient might be having a stroke. We talked about pre-hospital scoring system. We talked about certain key performance indicators which a stroke center should be doing. And we talked about the initial assessment in which an emergency department physicians should be doing. And the treatment options were discussed. I'm going to try my best to make another video in Urdu and Hindi. And if you have any questions about this video, please comment below or contact me via email. And I'll be more than happy to respond it to you. Thank you very much.